right. Hello, everyone. A warm welcome to this special vodcast. We have World Lung Cancer Day right around the corner, so this is the occasion for today. I have the privilege to be the host. My name is Dominik Ruttinger. I'm the Global Head of Research and Early Development for Oncology at Bayer Pharmaceuticals. And we're going to take on a pretty special and challenging topic, and that is NSCLC, so non-small cell lung cancer, and we'll make sure we go after every abbreviation and be as clear as possible here. The challenge comes with the late diagnosis, I want to say. So this is a malignancy, a tumor type that is diagnosed very late in the disease. But we're going to turn more to a specific subset of this type of cancer called HER2-mutant non-small cell lung cancer. And it makes up for about 2 to 4% of cases. Doesn't sound a whole lot, but if you consider worldwide, we see about 2 million new cases every year of non-small cell lung cancer. That really is a significant patient population. And we'll pay a particular attention to the journey of a patient, the unique needs of each patient. And for that, I'm just super delighted to have a really distinguished set of guests today. So firstly, we have Dr. Herbert Loong, and I'm going to look at my notes here because that is important. Dr. Loong is the medical director of oncology at the Chinese University of Hong Kong. Herbert, and he's a friend and a wonderful human being, I should add. Herbert serves as the clinical associate professor in the Department of Clinical Oncology of the Chinese University in Hong Kong, and is also the honorary consultant at the Prince of Wales Hospital in Hong Kong. He specializes in lung cancer, sarcomas, and drug development. And we're very thrilled to have you here today, Dr. Loong, with a specific perspective on HER2 mutations, obviously. And then I'd like to welcome Glenna Ring, who has previously been treated for HER2 mutant lung cancer. So, what a wonderful opportunity for us to learn the patient perspective here. So, Glenna, I think it's okay to disclose that you were diagnosed with stage 4 non-small cell lung cancer at the age of only 54. One can only imagine what the impact was of such a diagnosis. So thank you for being here and sharing your story. And finally, I'd like to welcome Andrew Ciupek, who is the Associate Director of Clinical Research at Go2 for lung cancer. Andrew, your insights in particular around patient advocacy, but also on the research that's done in this area will be very valuable, I think, to our listeners today. So thank you for being part of this important discussion. I'd like to ask my first question to Dr. Loong here. Some of our listeners may be familiar with mutations in lung cancer. Some may not. So could you start on a higher level and you just give us an overview on what are mutations in cancer and why is that important?
Sure. Thanks, Dominik. And it's a real pleasure to be able to join this panel and discuss this particular topic. So maybe just a bit of a background. When we talk about mutations in cancer overall, it's really these permanent changes or typos in a cell's DNA sequence. And now these changes can disrupt the normal instructions that the cells are told to, say, grow or divide or die. And so what happens is when there are these mutations, these cells would grow uncontrollably, so that it would form tumors. And specifically when we talk about HER2 mutations, this is when there's a specific permanent DNA alteration in the HER2 gene, which actually causes the HER2 protein, which is actually normally there to tell the cells to grow and divide. And the fact is, you could imagine this being a switch being stuck on the on position. So it's constantly telling these cells to grow and divide, and therefore leading to uncontrollable cancer cell growth. Now, when we think about HER2 alterations, actually, you may have heard of this alteration in breast cancer or even gastric cancer. These are the more common cancers with HER2 alterations. But actually, in that situation, it's in the form of what we call an amplification, where there are too many copies of the HER2 gene. In non-small cell lung cancer, though, actually the alteration in question is typically what we call a mutation, where there's a structural change in the DNA of the HER2 gene itself, and leading to what we call an oncogenic driver. And that is the reason why these cells continue to grow.
All right. Thank you, Dr. Loong. When you say oncogenic driver, I think that nicely illustrates the uncontrollable growth of the tumor cell. What does it look like in practice? So how many patients with the HER2 mutations do you see? What is there anything special about this patient group?
Yeah, so for HER2 mutations, it accounts for about 2 to 4% of all non-small cell lung cancer patients. It sounds like a small number, but if you think about the number of patients around the world who do suffer from lung cancer, it's actually a fairly representative population. And there does seem to be more common in patients who may be slightly younger, who are female, and with a lesser association with smoking history than some of the other lung cancers that we see. And there also seems to be a bit more common in Asians over, say, Caucasians or other ethnicities. But I think, again, we're still gathering this data as we're identifying more and more patients, as well as more treatments.
Thank you for those insights. Andrew, maybe a step back, so that maybe even prior to the diagnosis, in your experience, what are typical symptoms that prompted patients to even go see their doctors?
No, absolutely. I mean, as we've talked to a lot of patients who've been diagnosed, and among the things that I've often heard are, one of the typically most common is a cough that just won't go away, lasts for a long time, or other respiratory symptoms, people feeling short of breath, having a hoarse voice. But I also hear people mentioning sometimes chest pain or feeling unusually tired. And it's interesting because a lot of these symptoms can be associated with other conditions, however, not just lung cancer. We've often had people tell stories of, being considered for allergies or other respiratory infections before they got their ultimate diagnosis. But, one of the things that I think about lung cancer that's really important to note is that, often it's actually asymptomatic until it's at an advanced stage. So I've actually talked to people, especially those that were diagnosed at earlier stage, who actually had no symptoms, and their lung cancer was found by chance when their doctors were looking for something else. But, so not always symptoms, but but those are the ones that I commonly hear.
Okay. And then I guess they don't primarily see a specialist in this field if you're describing very unspecific symptoms. And I guess once they get to you, Dr. Loong, is, what is the usual stage of disease? And maybe you can explain what that means. And is that the same for the HER2 mutated tumors, or is there a difference maybe?
Yeah, so when we think about stage, we're actually talking about how much the disease may have spread or affected, say, different organs in the body. So typically an early stage disease is when it's located still within the lung itself. But as with all cancers, there's a tendency for the disease to spread to other organs. And unfortunately, most patients nowadays are still being diagnosed at a relatively late stage of their disease, what we call advanced stage, where the disease may already have spread to other regions in the lung or other organs, including, say, the liver, the bones, or even the brain. And I think it's very important for us to really try to push the envelope in diagnosing patients early, or even really looking at ways of, say, preventing lung cancer. And certainly that's the research direction for lung cancer overall. Now, there is actually an increasing push around the world for lung cancer screening, where we're hopefully able to diagnose patients at an earlier stage.
So now, Glenna, as someone who has really gone through this, does that match your personal experience, what we just heard from our experts? Does that sound familiar to you, what you just heard?
Yeah, it pretty much is exactly what they said. It started off with a cough, and it lasted roughly 6 months, but I have silent reflux. So when I went to the doctor, about after 3 months, We thought it was that because my throat was inflamed. It was really red. My cough was from my throat, not from my chest. I was having no issues breathing. So we just assumed that it was my reflux. So we're treating that. And then I ended up getting referred to a specialist for that. And then that last month before my diagnosis, I just kind of went downhill. The fatigue set in, developed shoulder pain on that side. Just couldn't do hardly anything. I just slept all the time and ended up in the ER because when I took a breath, nothing happened on the left side. It felt like it was stuck. So I went to the ER, had a full pleural effusion. And then, of course, then the scan showed a 9-centimeter mass. And I spent 4 days in the hospital doing all my staging, biopsies, everything that needed to be done. 2 thoracentesis were done. And the biomarker testing was done just right at the very beginning, both tissue and the liquid biopsy.
Thank you, Glenna. That's, you just the 6 month of cough, I remember, until you even started to go through a diagnostic with your treating physicians. Thank you for sharing that. And I'm going to go a bit back and forth between the treating physician and the patient here. Dr. Loong, you heard Glenna speak about a biomarker test that was performed. Can you explain a little bit? Is that a routine procedure, or how does that work?
Yeah, so as Glenn has already mentioned, she had both a tissue biopsy as well as a liquid biopsy. So essentially what that really means is getting the tissue from the tumor itself, as well as drawing blood, where we really want to use the two materials to do molecular testing. And specifically nowadays, we routinely do next generation sequencing, which is actually an advanced genomic testing technique that rapidly scans the tumor scans for tumor DNA or RNA. And of course, DNA and RNA are the recipes or the code books for the cells to divide. And by looking through that and to identify potential what we call driver mutations, the doctors then can prescribe what we call targeted therapies. And whilst we're looking at say 2 to 4% of patients who have HER2 mutations, when we think about all the other oncogenic drivers where there are mutations in their tumors of which there is targeted therapy available, in actual fact, we're talking about more than half of the patients nowadays potentially have these oncogenic drivers which are targetable. So therefore, it's very important for us to really push our health authorities as well as our hospitals to have this next generation capability for our patients in the diagnosis. And again, with being able to have good access to good diagnostic techniques, it really means, again, better therapeutic options for our patients.
Thank you. So you said NGS. I think this is a wonderful segue in our next section where we will be discussing and speaking about personalized care. A lot of our listeners are familiar with precision medicine, I would think. But now where the whole principle is that we tailor our treatments to the individual needs of patients. We start with the genetic data and cancer as a genetic disease. You described NGS as a means to analyze that. The environmental context obviously matters for each patient, and then if we are able to add real world insights, so outside of clinical studies, but the real world experience, I think this is the combination that makes precision medicine and personalized treatments possible. Question for you, Glenna. Thinking back on your own care journey, were there any times or moments even where you felt that that this could have been an opportunity for your needs to be addressed differently or more fully?
I was very fortunate in that my oncologist was very open, very straightforward, always open to questions. My care team, the nurses, no question was too small. My family could come in and they would spend time with them. He even spoke to my 8-year-old grandson. Well, he was 5 at the time, but 8 now. So I was lucky on that part that there was a lot of that. I would stress that communication is very important between you and your care team. And just be sure that you're getting that, not just the patient, but the caregivers, other family members, friends, anybody that goes to appointments with you, that there's open communication and that you can always ask questions.
Thank you, Glenna. And so I heard open communication and feeling heard and that caring for you and your needs. Andrew, you are at the forefront of this with your organization. How often does that happen? Like, Glenna seems to, she went through a good experience in that sense. And how often does that happen? And maybe you can give us a bit of a handle of what if that does not happen?
Sure, absolutely. I mean, a lot of people, are really fortunate, like Glenna, they have a great team behind them, and, that's the ideal. But I think, there always can be times when people living with, any type of lung cancer, may have a need they feel isn't being fully met or something that, isn't being addressed. And, this can be for a number of reasons. In general, I think cancer is complex, right? And it's really one of those conditions that requires a team approach. And we kind of talk about, the ideal care you can get when you have cancer is what we call a multidisciplinary team. And, Glenn alluded to having a team, and I think that's so true. You have your oncologist who focuses on treating your tumors and, can provide a lot of information, do other things, but, that there are other team members who can help you that specialize and deal with all kinds of the impacts of cancer. There's people like a palliative care specialist who can help manage symptoms and impact your quality of life. I mean, everything up to, some patients I talk to have a psychologist who helps them with the mental impact of living through a diagnosis. And there's even things like social workers or navigators to help you understand the healthcare system and deal with logistical and financial impacts of a diagnosis. So, I definitely agree with what Glenna was saying. We all totally encourage patients to just, have that open dialogue with their team. And, definitely feel free to talk about anything you're having difficulty with and not being afraid to advocate for what you need if you have something you feel isn't being fully addressed. Your doctor can often be a great starting point, and they'll often be able to directly help or refer you to a person or resource that can. And, just that team approach is so important. So, don't be afraid to, speak up and ask about things when you have questions or you have a need.
Very good. And so I'm hearing the same thing. You're saying open communication and reach out. And can we speak about the group of carers real quick? I think that's also very important because it sounds like everything's there. And sometimes with such an overwhelming diagnosis, you're just not able to navigate, and you need someone who takes you by the hand basically and leads you through.
No, that's such a great point. And when a caregiver is involved, I think they're absolutely a very important part of that team. I mean, I consider carers and loved ones to be part of that entire team approach too. And there's a really important role that people who provide care, loved ones who talk and interact with the person who's been diagnosed every day, they're directly observing and seeing how the person who's diagnosed with lung cancer is in their daily life, and to see how they're really living day to day with their diagnosis. And that can be really important information. And the doctors and people who only see you when you come in for appointments, may not, we really benefit from that perspective. A caregiver may be able to identify some needs more easily than doctors because they've had that perspective and were able to talk and interact directly. And, I think when you're being a caregiver, different people need different levels of support, and different people want to be supported in different ways. So I think it's important to have that dialogue, to be a part of the team. But the caregivers I've interacted with have helped in so many different ways. I mean, we've had so many different roles played, helping people get to their appointments, or just, some have even attended appointments with someone to just be that second ear or that note taker. Like you said, a lot of information can come really quickly. Just as you alluded to, navigating the whole process. We've had caregivers that help, keep track of appointments, the medications, the health records, just to help, take some of that burden off of the person who's, dealing with the diagnosis. Even just running errands or tasks unrelated when someone's feeling sick or overwhelmed. And, one thing we constantly hear a lot about is that, caregivers and loved ones are often the ones that are helping do research or ask questions or find information for patients. Helping talk through what to ask doctors before they come up. We've had, that's a role that a lot of people take on. And, of course, just in general, just being there. I mean, you're someone who's, can constantly, provide company, emotional support. You can go through this together. And, that's just the surface. I think there's so much more. And that's why I definitely consider caregivers an important part of this whole process.
Very good. Thank you. And Dr. Loong, does that kind of match your experience, and how do you support and interact with other important groups in the patient's journey?
Yeah, I think what Glenna and Andrew have said, from a doctor's perspective or a healthcare team perspective, it completely resonates. I think there are two key words in this. One is communication, the other is team. So for us, certainly good and clear communication is key. We need to make sure that we are conveying the right messages to the patients as well as their caregivers. And I think also communications between the healthcare team, our patients and our caregivers are actually seen by various professionals. We want to make sure that we're all on the same page within the team ourselves, and not to cause any confusion when we're communicating issues about the disease, the treatment, and the outcomes. And I think the other thing is we, as health professionals, sometimes we do forget the fact that we are speaking to the public, and sometimes we can get quite technical. Many a times there's been so much advancements in the treatment of lung cancer, it gets quite technical, but we need to be mindful of the fact that, we use plain language when we are speaking with the public. And so certainly as patients, if you feel that we're speaking too fast or too complicated, stop us. Make sure that you are actually receiving what you need to receive. And if there's any confusion or misunderstanding, please feel free to voice out. I think it's very important for us to empower our patients and their families and caregivers to be part of the whole medical treatment decision process, because it really is a team approach between the healthcare professionals as well as the patients and their caregivers.
Very good. So it sounds like a true example of systems thinking, I would say, that leads to success. Andrew, anything else you would like to add to this section of our podcast today?
Yeah, I just, really resonating with me is I think the two themes that everyone's hitting on here are, open communication and the fact that, this is a team approach. And, what I like to say a lot is it's important for someone who's, going through a diagnosis to consider all the resources you have for support. It's your main treatment team can be great, but there's a lot of other resources out there too. There's advocacy organizations like mine and others that, often have helplines or online information that can, be an extra player just helping provide information, connect you to resources. A lot of people I talk to eventually use, social media and other platforms or support groups to connect with other patients, having the ability to talk with someone who's going through the same experience. And just in general, there's so many examples like that out there. If you aren't sure if a resource exists for something, you have a need, just, don't be afraid to ask and, find out what's available in your area. And I think too, that treatment team can be quite big, that team approach. And I always tell people to make sure that you remember, you can always ask for a second opinion. Even if you're really comfortable with the way your doctor is and your treatment team is approaching things, sometimes it can be really helpful just to hear a different way of explaining something, or to hear how other types of people might approach your diagnosis. A lot of the people I talk to, sometimes have more than one provider they've seen at some point, or that they are seeing, and is giving them support on different aspects of their diagnosis or needs from a different perspective. And, just like we're all saying, cancer should have a team approach. And I don't think you should be reserved when you're advocating for different things when you need them as a patient.
So thank you, Andrew. And I'm sure you're going to get lots of requests based on your answer. Very valuable insight. Your points around leveraging wider resources and seeking second opinions, and I think the whole theme of more communication is something we heard a couple times now, and the importance of building a team and having a really good support system. So with that, I'd like to move to our next section, number 3, where I think we've now established that HER2-mutant non-small cell lung cancer remains a devastating disease with, in part, challenging patient outcomes. So we'd like to move now to making this more tangible. So really asking the question to our panel, what are steps we can take to fundamentally improve the patient journey and the outcomes of patients living with HER2-mutant non-small cell lung cancer? First question goes to Glenna again, reflecting on your personal journey here, through diagnosis. What is the one piece of information you wish you had known, or the question you in hindsight are saying, I wish I had asked that?
That's kind of a hard one. Again, my care team answered my questions even before I asked them. So a lot of it was like, my daughter had a list of questions, and when he finished his little kind of introduction and what was going on and all that, she looked at her paper and she goes, all my questions are answered. So, he was very intuitive on that. The biomarker testing, I think, is very important to really explain, because that was new to me. Like I say, I've worked for a pulmonologist, so some of the concept terminology of the different testing and stuff wasn't, new to me, new to my family. I had to explain a lot to them, but the biomarker and next-gen sequencing, all that was new. So getting that information out there to where people understand what it's for and what it can do and why it's so important.
Yeah, and that, what Dr. Loong earlier called actionable results of such a test, where we can actually have a treatment for the individual outcomes of the testing. Andrew, anything you would like to add in this section? So again, in terms of guidance for patients, recommendations, where can we find more information?
Yeah, I think we mentioned, a lot of the sources you can have. We talked about cancer being a team approach, and the importance of seeking out a second opinion just to hear a different perspective, even when you want to do that. And then also how patient advocacy organizations and cancer organizations can be a resource. But I think there's also some other things out there. Increasingly I'm seeing formation of patient-led groups around certain types of lung cancer, especially the formation of online communities for different diagnoses, and that really allowing patients to talk to each other and share information directly, which has been a great thing. I've heard from a lot of patients who found support and guidance through a support group. Some of those can be in person, at cancer centers or local centers. But also, increasingly I'm seeing more online virtual support groups. They're organizing sessions over video calls, allowing people to connect even when they can't be physically in the same place, and just being able to talk to someone else who's going through a similar experience like you. I think, the internet can also be a great source of information, especially there's a lot of high quality cancer news sites out there that are, spreading high quality, accurate information. I think some great examples I've heard are the American Society of Clinical Oncology. They have their ASCO Post section, which talks about new advances in lung cancer research and other types of cancer. The International Association for the Study of Lung Cancer, or ISLC, has their International Lung Cancer News, where they talk about research and advances specifically for lung cancer. And so I think, going to those kind of, high quality online sources can really, help you keep up with information that might be relevant to your diagnosis. And so, if you don't know where any of these resources are, you want more guidance, asking your care team, other organizations, other patients, and people can connect you. But just there's a lot out there that you can take advantage of.
Very good. And Andrew, I think your organization can help guide patients with that as well. So that's great. Dr. Loong, is there any advice you would like to give from your perspective as a treating physician?
Yeah, definitely. And just like what Glenna and Andrew has already said, I think it's very important to have good communication with the healthcare team. And overall, I think the most important thing is don't ever be afraid to ask. There is never a silly or an inappropriate question when it comes to your healthcare. And it's very important for you to be able to feel free to ask your doctor, the healthcare team, ask other patients, or involve and ask patient advocacy groups where you can share your experiences with those around you as well, and really try to get all the information that you can for yourself, as well as providing information to others around you. And I think ultimately communication is key. The doctors involved in your healthcare or in your treatment journey, each time they actually see you for a relatively short period of time throughout the entire treatment journey. So it's very important for you to also convey, say, some of the side effects that you're experiencing with your treatment, any changes in symptoms to the healthcare professionals. So then they could have a better assessment of where the treatment is going, whether or not there needs to be any changes in the treatment, and help you make the best treatment decisions together with you, your caregiver, as well as the entire healthcare team.
Very, very good. So we've heard again team and communication in your answer. Andrew, zooming out a tiny bit, any broader initiatives or structural changes that you think are necessary to further improve?
No, I think that's a great question. I mean, we talked a lot today about all the great resources that are out there, but there's definitely, areas as a community that we can improve on. Mentioning all those resources, I think one thing we can work is that they're available. Some of these patient-led groups, advocacy organizations, news sites, different doctors. But I think we could do more work as a community to ensure that patients are able to find and are connected with those resources more often. When I talk to people, it often, diagnosis is very overwhelming in the beginning. And you start learning from day one about your diagnosis and finding resources out there. And often, people don't connect with organizations like ours or patient-led groups online or other things until, they've kind of been diagnosed for a while. And so I think, we can really, work as a community. How can we make that proactive and make sure that we're all kind of upfront letting people know about the resources that are available? And, to that too, I also think there's always a way we can make more patient-friendly pathways and information sources, especially, one question we get a lot is about clinical trials and finding high-quality information about new treatment options. And I think, thinking, how can we invent the systems to, bring these opportunities directly to the people who are diagnosed rather than, having to have them find themselves. I mentioned caregivers often do a lot of help researching and supporting patients, but we can always work on making that information accessible in a more patient-friendly language. I think we have a really engaged community. I mean, just hearing from all of us on the call today, a lot of people are thinking hard about this, and really trying to make the experience better every day.
Very good. I hear optimism and encouragement, so that's great. Glenna, we'd like to close with the last question for you. From your very personal individual experience, what is it we could do as a community to improve the outcomes of patients like you with HER2-mutant lung cancer?
Again, keeping your family involved. When you go in, have somebody with you so they can take notes for you, because it is overwhelming. There's a lot of information, and I've even talked to other patients. They're like, I forgot everything the doctor said. And I said, well, you go back and ask them again. It's just that simple. Again, they understand. They don't expect you to grasp it all in one setting. So again, the communication and keeping your caregivers and family involved. Also, encouraging patients to still get out and be active. Do what they love to do. My husband and I are avid travelers, and we did an international trip a couple of years ago, and I asked my doctor, are we okay? Is it something that you're fine with? And he just looked at me and he goes, you have stage 4 cancer. So you can continue to do the things that you love for as long as you can, or when you can, for as long as you can. So the encouragement of still trying to find some normalcy, and not that you have to give up everything that you love. You just have to modify it, do it a little bit differently.
Wonderful. Thank you, Glenna. I'll remember that. Continue doing what you love to do. That's wonderful. I I'd like to close and by thanking, in particular you, Glenna, for sharing this very personal story. I think this added tremendous value to our podcast today. Thank you, Dr. Loong, and thank you, Andrew. I think the mix of these different perspectives made this hopefully very, very valuable listening experience for everyone. If I had to point out like the three most important things, we heard knowledge and connection, exchange, two-way communication. I heard from Dr. Loong, for example. Our ability today to individualize cancer care, molecular testing. We learned about NGS, next generation sequencing. I heard someone say, being informed empowers. So the more we know, and the better we will do. And Glenna, you reminded us beautifully. At the core of all of this is a person, a patient, who wants to continue to do what he or she loves to do. Wonderful. So thank you for listening, everyone. We hope this conversation, provided some deeper insights, resulting in the commitment of our community to do even better for our patients with HER2-mutant lung cancer. Thank you.